Welcome, everyone. We have people joining us from all over the country. It's very exciting. Thank you for joining us tonight for our first Medicare for All Coalition webinar of 2020, our Medicare for All Resolutions Coalition. I'm Melinda St. Louis, and I'm the Director of Public Citizens Medicare for All campaign. And I'm thrilled to be a part of this powerful coalition of allies that's been coming together to build a grassroots movement in support of Medicare for All, because we all believe that health care should be a guaranteed right and not a privilege. We've made some tremendous strides already as a coalition. Just in terms of the resolutions efforts, we have more than 270 local efforts underway around the country to win city and county council resolutions in support of Medicare for All, and that's thanks to many of you. You can find a map of those resolutions efforts on our website at medicareforallresolutions.org, and we will be pasting the map into the chat, so encourage you to look there. These local resolutions are part of our broader strategy to build our movement from the ground up, to educate the public and to urge our members of Congress to support Medicare for All legislation in the House and the Senate. We've made great progress. 2019, we achieved for the first time a really serious discussion and debate on Medicare for All in Congress during official congressional hearings in 4 committees, including the important Ways and Means and Energy and Commerce committees. And the Energy and Commerce Health Subcommittee held a hearing just last month, and which was very exciting, and it only took place because of the pressure activists had been putting on committee leadership over the course of many months. For example, activists in Santa Clara County successfully urged their county executive to send a letter to their whole congressional delegation that included Representative Eshoo, who's the Health Subcommittee chair, to express their official support for Medicare for All. So that's just one example of the power of this coalition. Tonight, we're going to get a readout from that important hearing from Representative Joe Kennedy of Massachusetts, who's one of the committee members who helped to make the case for Medicare for All during that hearing. And we'll also spend a bit of time tonight in tonight's webinar to tackle the economics and business case for Medicare for All based on feedback we've been getting from many of you activists who've been asking for strong arguments to counter the misinformation campaign that's being spread by corporations who are profiting off of the status quo. And we will get to hear exciting updates from our coalition partners in New Hampshire, Pennsylvania, South Carolina, Texas, and Tennessee, and we'll learn about new and ongoing efforts. So if you're connected via computer, please you can write questions in the comments in the chat bar, and our panelists will do their best to answer your questions. Or afterward, we will follow up with you. Feel free to email me questions at mstlouis@citizen.org if you're on the phone, and we will try to answer them after the webinar. So let's jump in. First, I'm pleased to welcome Representative Joe Kennedy III, who represents Massachusetts' 4th Congressional District. As I mentioned, he serves on the Health Subcommittee of the House Energy and Commerce Committee, and during the December 10th hearing, he did a fantastic job taking down many of the industry-sponsored false talking points that were being parroted by some of the committee members. So Representative Kennedy, thank you for taking time out of your busy schedule to share some insights with us.
Hey, I am so grateful. Thank you all for having me. You can hear me, right?
Yes, we can hear you great.
Thank you for having me. Thank you for allowing me to join you. And most importantly, thank you all for your engagement on this issue. Thank you for your efforts, your relentlessness, your patience, but your tirelessness, and your faith in your elected officials, our fellow citizens, to know that the harder and longer that we work on this, the closer and closer we're going to come, and we're not going to stop until we get there. And that comes down to a dedication and devotion that all of you bring to this. And I think it's, I know that it's absolutely critical, and I can tell you that because it is through your efforts that we have gotten to where we are today, including having that hearing, historic hearing, just a few weeks ago. But I can also tell you that because of a bit of my own story on how I came to be not just a co-sponsor of the bill, but one of the passionate advocates for an overhaul to our healthcare system that is so necessary. And I say that because we saw these efforts start to build back in the obviously over a series of years, but particularly pick up back in that midterm cycle back in 2018 around a support for a prior version of Medicare for All that was a codification of these values about the idea that healthcare is a right and not a privilege. There were some challenges with the actual text, though, that left out important things like long-term care and even, because it didn't touch the Hyde Amendment, access to women's reproductive rights, which is one of the reasons why I think a number of folks, myself included, struggled with the initial version of that text. It was through efforts like organizations like all of yours and efforts like those of you on this call and this video chat that actually helped build the momentum to inform efforts led obviously by the just amazing Pramila Jayapal to take that base and expand a text from a couple of pages to a comprehensive effort to actually meaningfully address the challenges, the opportunities, the crises that we have in our healthcare sector, and to come up with an answer for it. But it was the tirelessness and relentlessness of activists from around the country to say, hey, let's actually build on this. Let's make sure that it's not just a statement of values, but a real effort to actually address this, which enables folks like me to dive into the text of the legislation, sign onto it, knowing that there's efforts that there's questions we still have to answer, but to force that debate because we have meaningful, structured legislation behind us and an effort to actually do so. And with the effort that you all started to help build up and then generate the momentum that you generated, and again, the relentlessness with which you attacked Congress, basically took away every single excuse from an elected official not to have a hearing on the bill. And I hate to say it, but that is a bit of the challenge that we're up against when it comes to confronting a $3 trillion a year plus industry, is that there's an awful lot of people making an awful lot of money off of the way things are. And the challenge that we have is to not give any elected official any excuse not to meaningfully listen to our concerns and come up, if you don't want this one, come up with a better solution to the challenges and the equities that we confront. And I gotta say, the thing that ultimately, the issues that I ultimately wrestled with came down to a bit of a personal story for me, but my uncle, Senator Kennedy, Ted Kennedy, introduced a single-payer bill into the United States Senate in 1971. And if you go back and look at his speech, he started off his discussion by citing statistics like maternal mortality, infant mortality, and life expectancy. And he pointed to the statistics in the United States back in 1971 compared to other OECD nations. And yes, over the course of the past nearly 50 years now, those numbers have gotten better over time. But when you look at how our country fares to other OECD nations, our relative rank has actually fallen. And when you certainly segment them out for social determinants of health, so how they affect lower income individuals, how they affect minorities, it falls through the floor. 50 years. 50 years is a long enough test case. That is a long enough experiment to be able to test whether this iterative approach to expanding access and quality of healthcare is actually going to deliver us the fundamental promise that I believe this country is founded on, that we all are created equal, and that healthcare in our country, the richest, most powerful in the world, is a right that every single one of us should enjoy, because every single one of us is going to need it at some point, and it should be there for you when you need it. Just like we would want for our loved ones, it's going to be there for you because every person in this country is somebody's loved one. And so when you hear those stories about what happens, including on the cover of my home newspaper this morning, about the codification of racial inequities in our current system, we are going to have to force a massive change and put people at the center of it, patients at the center of it. And that's what this bill does. And that's why I'm so grateful for all of you for your efforts, your tirelessness, your relentlessness, and the energy that you bring to this. And I know you're not going to stop till we get it done. Thank you for all of your help. Let me know how I can be an ally, how I can be supportive of your efforts going forward. Melinda, thank you so much for having me tonight. Good luck. God bless.
Thank you very much, Representative Kennedy. We're grateful for the role that you played in the hearing, and we look forward to continuing to work with you and your colleagues in Congress to make the case for Medicare for All, and we will build the base that we need to win. So thank you very much for that, and for your words. Now I also note that somebody asked if Senator Kennedy's speech from 1971 is available on YouTube. We will look for that, and we'll try to post that in the chat as well. If you have it, if your staff has it, if you can send to me, that would be great. Now I'm happy to welcome Professor Jeannette Wicks-Lim, who is a research professor at the University of Amherst Political Economy Research Institute. She co-authored the seminal analysis on the economics of Medicare for All legislation that was published by the Perry Institute last year. And so we're very fortunate to get to hear from her to address some of these questions and around the savings that we would truly get from a Medicare for All system. So I'm grateful to welcome Professor Wicks-Lim.
Hi, great. Thanks, Melinda. Thanks for inviting me to participate in this webinar. So, the main message I want to convey tonight is that, in my view, the central question in this debate about Medicare for All really is not about whether the U.S. can afford to implement this type of policy. That seems to be the most common but misguided view about what the real challenges are around Medicare for All. So, bear with me while I get to my slides here. Okay. Is my slide apparent now? So what I'd like to start with is the big picture, and Representative Kennedy already alluded to this point, but before getting into any details about Medicare for All, what I want to point out is we know from experience is the United States currently spends significantly more on healthcare as a share of our overall economy compared to other high-income countries. When you look at countries like Spain, Canada, France, Germany, they're spending between 9% to 11% of their GDP on healthcare, whereas the United States is spending 17%. So in some of the comparisons, we're spending about twice as much as other countries. Now, in all of these countries, they all provide universal healthcare, and at the same time, the US ranks behind these countries in terms of health outcomes, such as amenable mortality. Those are deaths that could be averted with medical care. So I think it's really important to keep these facts in the forefront of your mind when thinking about or talking about Medicare for All. We spend more on our healthcare here in the US compared to other high-income countries, and we don't provide universal healthcare, these other countries do, and we don't get better health outcomes, and these other countries do. So next I wanted to there we go. Okay, so next I just want to get into some of the details about the economic analysis that Melinda just spoke about. In 2018, my colleagues and I at Perry produced a report to look at Senator Bernie Sanders' 2017 Medicare for All proposal. This report is about 200 pages long, so if you're interested in the details, you can find this on our website, and I have it listed. For those of you who are on the phone, it's perry.umass.edu. Tonight, I'm just going to show you just briefly the highlights from this study. In 2017, these are the numbers we worked with because that was what was available at the time. The U.S. spent in total $3.2 trillion on healthcare consumption, and that includes spending through public programs such as Medicare, as well as private spending, like what you or I might pay out of pocket or through our premiums to private health insurance companies. We then looked at the existing body of research to estimate how the spending would change if we implemented a single-payer type program like Medicare for All. And our bottom line finding is that the cost savings that a single-payer system could achieve would more than offset the cost increases that would occur as healthcare consumption goes up with universally accessible healthcare. So let me fill in the details a little bit. In this next slide, I just show the cost increase and then the cost savings line by line that we look at. So let's start with the cost increases that would result from the rise in demand for healthcare that would result from making healthcare universally accessible. We estimate the increased demand for healthcare by assuming that all of those who are currently uninsured, as well as those who have insurance but are underinsured, would increase the amount of healthcare that they would seek out so that they would receive at least the same level of healthcare as those who are currently fully insured. And then we topped it off a bit so that we weren't underestimating this cost increase. And we estimate that that cost increase would be about 12%. But this is only half of the story. The virtue of a Medicare for all approach to healthcare, a single payer system, is that it has the potential to deliver significant savings. Now, the various savings that we estimate in our report include, first, lower administrative costs. With Medicare for all, we would eliminate the profits that go to private health insurance companies and also the mountain of health insurance related paperwork that healthcare providers have to process in order to get paid. We estimate that a savings of about 9% of healthcare spending through lower administrative costs. We also estimate that we would have lower drug prices through Medicare for All's greater negotiating power with pharmaceutical companies. We have home-based examples of this in Medicaid and Veterans Affairs. These programs leverage their large purchasing power to get better prices from pharmaceutical companies. And what you see is the agencies negotiate prices that are 40 to 50% lower than overall market prices. So we estimate cost savings due to these lower pharmaceutical prices at about 6% of total healthcare spending. We also look at, in this study, what would happen if we use Medicare rates for healthcare providers. With a single payer system, we can standardize the reimbursement rates that we use for healthcare providers for their services. And we estimate that using Medicare reimbursement rates would result in a modest decline in the fees that medical providers could charge for their services. But remember, these same medical providers will have more time to see patients because Medicare for all will reduce the amount of health insurance paperwork that they would have to deal with. So this increases their billable hours. As a result, on net, the average medical provider should not see much change in their income. And we estimate savings due to using Medicare rates at about 3%. And then finally, we can achieve great efficiencies in the delivery of healthcare through a Medicare for all approach to healthcare. A clear example is with universal coverage and no cost sharing, we would be able to increase the use of preventive care. So we'd reduce the higher costs of missed opportunities for prevention. In addition, with a single payer system, payments for healthcare services will flow through one agency, making it easier to identify and reduce such activities as fraud or unnecessary services. We would see about a 1.5% savings in overall healthcare spending in this area. Overall, we conservatively estimated that a Medicare for all type system could achieve cost savings on the order of 19.2% of healthcare spending. So this gets us to our punchline, which is in this picture. I show a figure showing that what our current spending is on healthcare consumption is $3.2 trillion. We estimated that the increase in healthcare consumption would go up by 12% with universal healthcare. So that brings us up to $3.6 trillion. But then when you take into account the 19.2% healthcare cost savings from Medicare for all, that brings down our overall healthcare spending to $2.9 trillion. So the net result is a saving of just over $300 billion. That is, under a Medicare for all type system, we would spend $300 billion less to provide more healthcare for more people. Now, this is the context that you should have in mind before tackling the question of, how can we pay for Medicare for all? It should, once you see these numbers, it should come as no surprise that we can pay for Medicare for all and cut healthcare spending for the average family. So I just want to close by emphasizing that the central challenge to Medicare for all is not about whether the U.S. can afford to implement such a policy. It's really not about the economics. We currently spend more on healthcare to produce worse health outcomes than is the case among many countries with universal healthcare systems. The central challenge for Medicare for all is really about politics. Thanks.
Thank you, and thank you so much. And I think the central point there is a critical one, and one that activists can use as they're making these arguments to local officials, that again, this is not about whether we can afford it. What we can't afford is our current system. So thank you, Professor Wicks-Lim, and there were a couple questions in the chat that maybe you can address. I'm now kind of following along the same piece of argumentation. We wanted to also look at the business case for Medicare for all, because that's another argument that's brought forth by by the detractors. And we're really lucky to have with us one of our close coalition partners, Richard Master, who's the founder and CEO of MCS, which is North America's leading supplier of picture frames and decorative mirrors. And he's the founder of Business for Medicare for All. He produced films Fix It, The Healthcare at the Tipping Point, Big Pharma, Market Failure and the Big Money Agenda, and Democracy on the Brink. And he's recently been part of a successful effort to pass a resolution unanimously through the Bethlehem, Pennsylvania City Council, and is engaged in other local resolutions efforts in the Lehigh Valley of Pennsylvania. So welcome, Richard.
Thank you very much. It's a pleasure to be here. And it's appropriate that we follow Dr. Lim's remarks. The business case is a bit different than the macroeconomic case, and you know, you have to understand that private insurance, commercial insurance, is about $1.3 trillion now of the overall money that goes into paying for this bloated healthcare system that we have, and about 600 billion. Of that is paid by businesses themselves, and another 200 to 300 billion is paid by employees who have to come up with premium shares as part of their employment relationship with employers. So the question is different for them, for businesses and for employees. It's what will we pay to provide coverage under a Medicare for All plan versus what do they pay right now? Kaiser Institute has come up with surveys, and we've now crested that a family plan in the United States is averaging $20,000. Well, we have to look at that family plan. What kind of plan is it? Most of the plans are high deductible plans that are unfortunately not easily usable. They have economic barriers for employees to access the system. And we know that 20 to 25% of our employees who are insured are not accessing the system. They're either not going to the doctor when they need to go to the doctor. They're not filling prescriptions that are prescribed by doctors. So we have to really question that $20,000 number. I know that at my company, MCS Industries, the number is $30,000 a year for a low deductible plan. We self-insure the deductibles. A family would only have to pay $1,000. It is a significant amount for a family to come up with if there is a medical crisis. But we have kept the number down to $1,000. What is $30,000? It's $15 an hour, which is an outrageous amount if you really think about it. So what will they pay under Medicare for All? Well, the Pollen study and studies that we have done on how to pay for Medicare for All indicate that the payment as a payroll tax would be somewhere less than 10%. The Pollen study came up with 8.5% as a payroll tax. And that was before the long-term care provisions of the Jayapal bill were included. And so I think we're probably coming up with somewhere around 10%. Well, what does it cost MCS? It costs 22% of payroll. What are our employees paying? They're paying roughly 25%, which is typical across the board in the United States as a premium share. So we see that Medicare for All would be a substantial savings. Okay, let's look at the quality and features of the coverage. And the opposition talks about choice. Well, our employees under Medicare for All would get a card that would entitle them to go to any provider in the country. In Canada, we've done a lot of filming in Canada. These are province-based systems in Canada, and employees in Canada can go to any provider, any hospital in their province. And what choice do employees have right now? They have very little choice. It's the employer who chooses. It's the employer who chooses the plan. It's employer who chooses with the insurance company, the network, and the formulary of drugs that would be appropriate to prescribe, et cetera, et cetera. So the system provides a much more robust level of choice and freedom of movement than we would have. There would be, the other question is volatility from year to year. What is going to happen to this expense for my company? And we've seen it, frankly, this past year was very, very difficult. We have a very loyal workforce at MCS, and they've stayed with us for years and years. So we would characterize our workforce as an aging workforce. And we've seen, as a result of that, this year particularly, a 16% increase year over year in the premium cost, which is a major increase. And we didn't anticipate that. And I've talked to other employers across the country, and some of them are very fortunate. They have a 5 or 6% increase, but many of them have had in excess of 16%, 20%, 30% increase year over year. And you cannot plan for that. It is a major cost, and it's a volatile cost. Medicare for All neutralizes those increases, and with the negotiating power that CMS will have, particularly over this runaway cost of pharmaceutical drugs that we're all experiencing, and with hospital services as well, which is a very major expense, we're going to see a much more gradual increase, something related to inflation, which we don't have right now. I mean, what we're seeing in the that's in CMS is forecasting, and the budgets are experts are forecasting, is that that healthcare cost under the status quo will increase somewhere between 1 to 1.5% more than the growth of the economy, which means we're going from 18% right now, close to 20% by the middle of the 2020s. Untenable. So those are the macro, and how will it affect my employees? I don't want to take too much time here. How will this affect my employees? This is something that is a subject of dialogue, because we're a different kind of company, and a number of our employees have really gotten involved in the thought behind our initiatives. Our company has a pretty robust social agenda, and we have conservatives and we have progressives, but it's remarkable how, when we inform our employees, how enthusiastic they become and how supportive they are of this initiative at our company. Let me talk just a little bit about Medicare for All, the business case for Medicare for All. We now have 3,000 businesses across the country in 49 states. If anybody knows a business owner in North Dakota, please let us know. We want 50 states. But we're really doing great. We're funding an initiative in South Carolina to present Medicare for All as to do canvassing across the state, bringing doctors into the state. So my co-founder Wendell Potter, who many of you know in the movement, is going to be in Iowa with our executive director of our business group in the next few days. So we're very active, very enthusiastic, and we're seeing a lot of progress. Hey, thanks a lot, Melinda, for this opportunity.
Thank you so much, and we are so grateful for all of the work that you're doing to mobilize business owners around the country, and for the efforts to pass resolutions in your community as well. And we're looking forward to continuing that work. So thank you, Richard. And now we're lucky to have another business owner from the other coast, Jacob McKean, who is the founder and CEO of Modern Times Beer, which is a craft brewery based in San Diego, has 300 employees at 7 locations across the West Coast. And Jacob has also become an advocate for Medicare for All. So Jacob.
Hey, how's it going? Can everybody hear me?
Yes.
Great. So yeah, I want to focus on basically leveraging the business case as a rhetorical tool to try to build awareness and support for Medicare for All. I think the moral case and the health case for Medicare for All is strong enough on its own. I don't think we necessarily need to, from an ethical perspective, make this argument, but we need to acknowledge that the arguments in favor of things that are beneficial to American businesses hold a lot of sway in the political discourse. So leveraging all of the power in the hands of entrepreneurs to try to build the case for Medicare for All, I think, can be extremely powerful and valuable. And I think also, if we're going to actually get this thing passed, we're going to have to, at the very least, get some business owners off the sidelines and get them into an advocacy role. I've personally participated in a number of different ways, primarily through writing op-eds for local publications, which have been really well received and have helped add nuance to the discussion locally around initiatives that are being passed by city councils and things like that. And then I've also gone into meetings, usually in coalition with other folks, with lawmakers to try to build the case for Medicare for All. And that's been really useful because in those meetings, lawmakers are really accustomed to meeting with generally the same types of folks, people who are professional advocates for one reason or another, or have some kind of personal interest in the outcome, either for financial reasons or whatever it is. And what you hear a lot in those meetings is, well, what about small business? And this is like, it's the laziest, easiest thing to throw out there. No one really knows what it means. But if a small business owner or an entrepreneur is actually in that meeting and is armed with the facts around Medicare for All, you can neutralize that argument right away and actually build a really powerful case for why this is useful. And so just to go over some of the basic arguments here, if anybody out there has ever considered starting a business or started one on their own, there's not a single person on the planet who does it because they are excited about dealing with the private healthcare market. It is, for everybody who starts a business, a burden. It is incredibly complex. It is extremely expensive. And it's a mess. It's not why anyone goes into business. I started a brewery because I'm extremely passionate about craft beer. Not once was I thinking, oh boy, I can't wait to deal with healthcare brokers, to deal with annual double-digit cost increases. It's a major distraction from the real mission of entrepreneurship, which is to build a great business, to focus on what we're passionate about, and to make great products. So the argument I often deploy in this case is the private healthcare market is a drag on innovation. It prevents entrepreneurs from focusing on their mission. It prevents us from building the companies we want to build. And it basically functions as a private tax on every small business in this country. We have no choice, of course, especially for companies that are over 50 employees, but to provide healthcare as we should. But that also means that we're at the mercy of the private healthcare companies to accept whatever they offer, essentially. And if they say prices are going up this year, then we have no choice but to pay it. Whereas in Medicare for All, the money goes into a democratic system where we have say over how healthcare is run in the country. We can elect or recall politicians and so on and so forth. So it takes it from a totally undemocratic private system where costs are completely out of control and moves it into a democratic system with proper accountability. The real case for making this to an entrepreneur or a small business owner that I like to make is, how often do you think about Social Security? The answer is always never, right? Social Security is a line item on a payroll. You never give it any thought. You never have to call a Social Security broker, deal with all kinds of nonsense around it. You don't have employees constantly trying to troubleshoot their coverage for Social Security. It just is part of the payroll system, and every month it's exactly the same. And there's really on the part of the small business owner, there's essentially no effort or thought that goes into it. And from my perspective, that means it's perfect. Whereas healthcare is the opposite. It's a total mess. It's a burden for every business owner. And so what Medicare for All really offers is the opportunity to move it from the Byzantine system it is today into a universal system like Social Security. And I think part of the reason this argument is potent as well is that Social Security is an immensely popular program. Even when this country was being run by Paul Ryan, Donald Trump, and Mitch McConnell, they could not touch Social Security because it is so popular and it is politically untouchable. So equating these two things, Medicare for All and Social Security, has a lot of benefits, both politically and logistically, and it also has the benefit of being true, which is always good. And so that's an argument I really like to deploy both with lawmakers and with small business owners. Definitely a useful thing to do. And that's something you can also have folks focus on in the context of op-eds or meetings they have and things like that. So definitely a good way to approach it.
Thank you. That is extraordinarily helpful. I think we will all use those, and we really appreciate you taking the time to be with us today. Thanks so much. And I think hearing these economics and business arguments for Medicare for All can really help activists from around the country recruit new folks into the campaign, as you were saying. And because we demand healthcare for all because it's morally right, but what's highlighted here is that there's no reason we should be on the defensive on cost and economics. And in fact, Medicare for All could be an important economic stimulus, putting money in families, small businesses, and municipal budgets. So I want to turn it over now to updates from our activists from around the country, because there's really exciting things happening, and I want to encourage all of you to get involved as well in your communities. So first I want to invite Brittany and Heather. Brittany is with Public Citizen, but she is up in New Hampshire right now with Heather, who's with Rights and Democracy, doing organizing around the exciting town meeting structure in New Hampshire. Brittany and Heather.
Hi, I'm Brittany, and this is Heather. And Heather is with Rights and Democracy, New Hampshire. Did you want to say something about Rights and Democracy's work on Medicare for All?
Yeah, that's something we've got into in the last year. It's become part of our platform. We have a multi-issue grassroots platform. We're a member-led organization working on the ground to build power right in people's communities. So this is really exciting to have Brittany here right at the start of our opening day of our legislature here in New Hampshire on Wednesday, just yesterday. So yeah, we're excited to be part of it.
Right, so if you didn't hear that, we are in New Hampshire. There is snow outside. I saw a mountain today. I'm from the Eastern Shore, which is below sea level, so these things are marvelous to me. But so we've been here, I'm here for a little bit, for a few days, to talk to folks from all over New Hampshire about this upcoming town meeting session and about passing resolution in cities. Heather, do you want to remind us what the town meeting system is?
Yeah, a lot of people don't understand town meetings in other states. It's kind of a small New England town thing where we make decisions about how we spend our money and what, if we need a new fire truck or all kinds of things. But it's also a time that people can present warrant articles on a number of different topics that they might be passionate about. We actually passed one in our town in 2017, excuse me, around protecting our immigrants. There were also some around Citizens United back, gosh, what year was that, Brittany?
Oh, that was
kind of a while ago now, but it's a way of affirming in your town that you all stand together in support of a belief or idea.
Right. And so we've been having these meetings across the state, and there's going to be some more meetings. If you're New Hampshire and you haven't gotten in touch, get in touch or say something in the chat, because it would be great to join you at some point. One of the main reasons why we're here is like specifically Ann Custer, who is on the Energy and Commerce Committee and the Health Subcommittee, hasn't signed on to the bill. And so it's with all the political focus on New Hampshire right now, it's a great time to be talking about Medicare for all. Everybody's listening, and I'm really excited about the work we're doing. So thanks so much for featuring us. Back to you, Melinda.
Great, thank you so much.
Thanks.
Excited to see what happens in March with all of the town meetings in New Hampshire. Next, I'd like to invite Afton Ben, who's with an organizer with Indivisible, one of our important partners in Tennessee and Kentucky, to give an update about some of the resolutions efforts that are underway in Nashville. Afton?
Yeah, thanks for having me. So for those of you who don't know a little bit about Tennessee, we have an expanded Medicaid. We are ground zero for the worst healthcare policies in the country. Work requirements, block grants, you name it, whatever the Alec brothers dream up, it is passed in Tennessee. But we have an opportunity here because Nashville is the healthcare capital of the country. So the headquarters of HCA are in Nashville. Blue Cross Blue Shield's headquarters are in Chattanooga. So Tennessee is the epicenter for the for-profit healthcare industry. And a lot of organizing has been around. We have a Democratic congressman currently Representative Jim Cooper, who has refused to sign on to Medicare for All. So a lot of the organizing in Nashville is indicative of what we want to see, the narrative around Medicare for All, and what we want to see across the state. And so particularly in Nashville, what we're doing is we're working to pass through our Medicare for All advocate and our city council, which we got elected this year, really exciting. We're working to figure out what the economic argument at the city level is to pass a Medicare for All type bill and resolution, and in the hopes of putting some pressure on our Blue Dog Democrat Representative Jim Cooper. And so we're really excited to see kind of what happens. The other piece is, I think, for those of you who are in non-expansion Medicaid expansion states, it's really a hard push to be a proponent for Medicare for All and to get your people running for office, to get your local healthcare advocacy organizations to be talking about Medicare for All. And so our goal is to offer a more comprehensive approach and narrative to Medicaid expansion, which is, yeah, we want to expand Medicaid, but we really want healthcare for all. So I'm really excited. It can be done in a southern state. We are one of the most conservative, religious, white states in the country, and there is a Medicare for All contingent, and we are working so hard to bolster the Medicare for All narrative within the state and in national circles to make Nashville and Tennessee a Medicare for All utopia, if you will. So, out of great destruction, as they say, I don't know who said that, but from great destruction comes great opportunity. So even though we're number one for all of these things, we're really excited to be thinking in big picture and to be passing these Medicare for All resolutions within our urban cores to put pressure on our state legislature and federal government.
Fantastic. Thank you so much, Afton. I think that's what's powerful about this tactic, is that it is relevant in blue states, red states, purple states, and so that I'm really excited to have Indivisible on board and to have folks in Nashville engaged on this. So thank you so much for your update. We will have you back as you make more progress. Next, we'll have an update from another important partner organization, which is the American Medical Student Association. So obviously having physicians and medical students on board is critical. So Hanan McKean is the chair of AMSA's Healthcare for All Committee to give an update as well. Hanan.
Yeah, thank you, Melinda, and thank you so much for having us. As Melinda mentioned, my name is Hanan. I'm this year's Healthcare for All campaign co-chair. And one of the biggest things that I wanted to bring up is we're having our Healthcare for All Week of Action coming up this January 13th through 17th. So what I want to do is screen share with you guys and show you our overview. Right over, 1 second. So I'll go into detail a little bit, but this is a brief overview of what it looks like. So for this year's week of Healthcare Week of Action, we're really urging as many medical and pre-medical students to join the Healthcare for All campaign, to share experiences, advocating for Medicare for All resolutions, Medicaid expansion, and addressing a lot of common myths about Medicare for All. So how we decided to do that is we split it up obviously into days. So our first day, which is this upcoming Monday, is our story sharing. Second day is a Medicare for All resolutions. Third day is Medicaid expansion. Fourth day is the myths. And fifth day is like a, now it's your turn and advocate. So advocate. So for Monday, which is our story sharing day, what we did is we sent a huge spam email to a bunch of our allies, a bunch of our active chapters in AMSA, to get as many people as we can to send a short video, like a 30 to 40-second video, explaining why they support Medicare for All, why it's important, and why as future physicians, that would be like an important thing to have in place so that we can provide, of course, like all of our patients, the quality of care that they need. So we had, again, a lot of our allies, medical students, AMSA board, create a short little video, and we compiled all of the videos into one. So Monday is going to be the day where we show our video to hopefully gauge a lot of the audience on our social media platforms, which is our AMSA National Instagram, and of course on our website as well. So hopefully that'll be like a good way to kick off the week, and everyone will just sort of like understand and get a sense for those who aren't aware of what's going on or like why it's important. They'll hear a bunch of different perspectives, from patients to medical students to practicing physicians to allies outside of the medical field, to see why we all support healthcare for all. And then our second day is Medicare for All resolutions. So with this, we're actually having Melinda give a webinar talking about what the resolutions are, how we can get involved, and all of that stuff. Third day is Medicaid expansion. So for Medicaid expansion, I actually created a toolkit. And so in our toolkit, we have a bunch of different resources talking about, again, like why Medicaid expansion is important, where Medicaid expansion is passed, and what states it is and what states it's not. The whole goal of this day essentially is for us to, we provided all these resources on like Medicaid expansion, how to write an op-ed about it, write a letter to the editor, so that hopefully everyone will take all the resources from our toolkit and then be able to draft an op-ed or a letter to the editor so that they can submit that for publication, of course, and either write in support of why they should have Medicaid expansion or why their state should keep it. So what we're going to be doing on this day is, besides sharing our toolkit, which will also be posted on our website, we're going to have this like a webinar, basically like it's like a talk through on how to write an op-ed and how to write a letter to the editor. So we have Brad, who's on our Healthcare for All steering committee, and also Keenan, who's the AMSA Education and Advocacy Fellow. They're going to be giving a run through of like how they've written op-eds, how they've written letter to the editors, because it seems really intimidating at first to a lot of our students, and I mean to the general public as well. So we just want to have them like give a brief overview on what the content is like, how they can take our toolkit resources and edit that up so that it could sound really nice and hopefully be published. So that's our Thursday, and then we also have our last day. I think I skipped over the myths. That's our Wednesday, sorry. So Thursday for myths, we created this little flyer, and essentially, so Public Citizen also, we did have little like flyers but adapted from materials from Public Citizen, because they had a lot of resources on some common myths that the general public normally has. So like it would cost too much, the quality of health has decreased, and the government wouldn't be able to support it. So we just, we took the most common myths, created into a flyer, sort of like debunked the myth, and just plan on sharing that. Just so, again, a lot of, as advocates and future physicians, just so we'll probably get a lot of patients or a lot of other healthcare professionals that we speak to, and they'll normally have these common arguments. Well, it's going to cost a lot, that the quality of care isn't good. So these will just be like things that we can say back. So we know there's a lot of healthcare practicing professionals. We know like our job, most of the part is like delivering the care, but when it comes to, let's say, the political or the congressional aspect of it, we aren't exactly sure. So this is just a way how to help everyone who's like in the similar battleground, so sort of know the background, the essence behind it. Like, so how you can be a better advocate is so to be more aware and have this information. So that's why we did this. And then Friday is just sort of like your take action. So the main point of this day is just like, now you hopefully everyone's inspired. So to call your congressman or woman and just explain why we need Medicare for all. And that's our week of action. So yeah, it's starting next week. So of course we'd love to have as many pre-med medical students or anyone outside of that as well. The more support, the better. We just really want to get the word out as much as possible. And we really feel like this would be able to help a lot of the general audience gain a better sense of, you know, what the problem is, like with Medicaid expansion, the resolutions, and how a bunch of students can help. And yeah, thank you so much, Melinda, for giving us a chance to talk about it. And if anyone has any questions, I'll read in the comments section, and you can email me at HCFA, which is hcfa.chair@amsa.org. I'll also like write it in a text box too, and I can send you more information if you need any. Thank you.
Great, thank you so much, Hanan. And having medical students as part of our resolutions efforts is very exciting and important. So thank you so much. Since we're running a little late, I want to move on to invite Clayton Tucker, who's with Our Revolution Texas, which is an important partner of ours, and Medicare for Y'all, to share an exciting update about the coalition organizing that's moving forward a resolution in Dallas County. So Clayton.
Hey y'all, so really glad to be on this call, and thank you all so much for being here. Quick update about what we are up to. Us, Public Citizen, DSA, Texas Organizing Project, and Deb Jones Douglas Institute are working together to get a resolution passed through Dallas. It looks like that resolution is going to be up for a vote January 21st. I will be posting a copy of the resolution in the chat box. And if you are unable to see the chat box, just reach out to Our Revolution Texas or Public Citizen, and we will make sure you see it. One of the things we are really going with this is, you know, we talked about how Medicare for All will save businesses. Well, if it saves businesses money, then it would, by extension, should be saving counties money. And we have a rough calculation of how much the county of Dallas will save. Now, the Dallas County is very big, so it looks like it'll be saving, I'm playing a little bit of the memory game, but it's around $56 million, which means, well, that's more money for schools, much more money for roads, or they could, I don't know how counties are funded elsewhere in the other states, but in Texas, they're funded through property taxes, which means Medicare for All could also lead to a reduction in property taxes. And that is something that county commissioners really like to hear. So that is how we are really doing that. So hopefully we will have some very good news during next month's call. So we are also trying to get a resolution passed and all of that. So if you have any questions, just again, reach out to ourrevolutiontexas.com or Public Citizen, and we'll be happy to let y'all know what's all going on. Thank y'all.
That's great. Thank you so much, Clayton. It's really exciting to see again where our updates this month are from southern states, which I think is fantastic, and it's great to see the movement building there. And now I'd like to invite Carrie Harris, who has been working with several different organizations, including Richard Master and others in some of the organizing around in South Carolina in the build up to the early primary there. So welcome, Carrie.
Hi, thank you. My kids were running around, so I was not on video. So if one pops up, just know that's what it is. But thank you again. My name is Carrie Evelyn Harris, and I work for Medicare for All Now. We're a single issue organization that is fully focused on making sure that we end up with a universal single payer system here in the United States. What we are most proud of is that we are a coalition partner. So we work on building a coalition with multi-issue organizations who have an interest in promoting Medicare for All, but because of limited resources, it can't be their primary focus. And so we work on amplifying the work of our coalition partners to make sure we're all working in concert, and that the elected officials who are not actively working with a sense of urgency to pass Medicare for all, as well as the for-profit insurance industry and big pharma understand that we are a mighty army out here. All of us that have spoken, those of you who have not, who are doing great works, are all working towards the same effort, which is to make sure we're saving lives, saving money, and doing what is morally and fiscally responsible for our nation. One of our things that we're working on is action in South Carolina. South Carolina has a late primary, but relatively early, so it's considered one of the battleground states. Its primary is February 29th, and our goal is to move the needle, making sure that the voters in South Carolina choose Medicare for all as one of their top 3 reasons they select a candidate up and down the ballot. It is important to us to highlight the fact that oftentimes change at the national level comes as a result of pressure at local levels, and so resolutions that are passed, in the different states that all of you guys are working on, much with the help of Public Citizen is very important. And we know that if we don't make sure that candidates at every level are speaking to the fact that this is a necessity, we are going to lose this race. But we do know that there are many of us that believe in this, and there are people who would be moved by this if they had the truth about Medicare for all in their hands, in their minds. Unfortunately, we are working against a major propaganda machine that has more money, but we have more people. And so we will be putting boots on the ground in South Carolina, making sure we are knocking doors and having effective conversations at those doors, and then inviting people to events where they can get the information and benefit from the fact that we aren't hiding any truth. So we let them know what other options are out there aside from Medicare for all, so that they can say with confidence why they too will now select Medicare for all as their only option for healthcare reform in this nation. We encourage anybody to jump on with us. Again, this is a coalition. We can't do it without you. Even if you're not in South Carolina, please go on to MedicareForAllNow.org, sign up to volunteer. We will phone bank, text bank. It's going to be a grassroots effort, just like it would be with an insurgent campaign at the electoral level, and we need everybody's help. If for some reason you are able to make it to South Carolina, let us know. We could use more door knockers. If you'd like to show up at an event, Hanan, if you have medical students that would like to help out at some Ask the Doctor events. Jacob, if you have more business owners who would like to show up at Ask the Business Owner events, that would be very helpful. We need all hands on deck. And then please use us. Let us amplify your efforts. We just added an events page that to our website, and we want to make sure any Medicare for all effort happening nationwide is amplified, and people can put in their zip code and know what is happening where they are, and we can drive information your way. So thank you for everything, and please reach out. My email is Kerri, Kerri, at MedicareForAllNow.org.
Great, thank you so much. And before we end, well, first of all, I just want to note, and I noticed people saying in the chat, I mean, this is an incredibly impressive lineup of folks who have given really important information and very inspiring stories. And I know that everyone else here also who is participating is also engaged in your communities, and that's what's clear from these updates, is that our movement is vibrant, it's strategic, and it's growing. We also have our work cut out for us, of course, and so we hope that if you're not already connected to an effort to pass a local resolution, that you visit our map, and I did put that in the chat. I also just want to really quickly share, just for folks who are new, this is the website. It's Medicare4allresolutions.org, and we have a map of the 270 efforts underway with the resolutions that have passed, and we can put upcoming events on there as well. And this is a coalition effort of all of the organizations here that have presented, and many more. So very excited about that, and please do to sign up and make sure that you are engaged and involved. We have the tools on that website. There's a comprehensive toolkit, and we will also do talk to you and do one-on-one support in communities as well. And the other thing I want to note before closing too is that I was really excited to hear about the story sharing group effort that AMSA is taking up, but we also would like, if you would like to share a short video of yourself or people in your community, we also would love to highlight those on the website and social media. So a 10-second to 1 to 2 minute video where you answer the question, why is winning Medicare for All personal for you, and or why you're organizing for Medicare for All in your community. We really want to highlight those videos, and we'd like everyone to say in their video, the fight for Medicare for All starts in my community. So keep a lookout for that. We'll be sending an email about that. And you can send emails to me or send them to me at mstlouis@citizen.org. As I mentioned, we have the website, the toolkit. It's a really robust coalition. Thrilled to be working with all of you, and please let me know. Send me an email or send Brittany an email. She also will put hers in the chat. If you would like to give an update from your community on an upcoming webinar, you can mark your calendar now for our next webinar. Will be Wednesday, February 5th at the same time. So keep a lookout for that. We will make the recording available, and we will make sure to get all the questions and it was really exciting to see all of the engagement of folks all around the country with the topics today. And if you have ideas for what we can have on future webinars and the support that you can get, we will be following up with all of you in the different communities to be able to turn those 270 efforts into 270 resolutions passed, so that we can really start to build up the national conversation and keep Medicare for All at the center. So again, the website is www.medicare4allresolutions.org, and I look forward to continuing to work with all of you, because I know that we will win in the end with all of this energy. So thank you so much, and have a great evening.